Today in this video, I'm gonna talk to you regarding fever, basics of fever, home management during such episodes of fever. Hi, I'm Dr. V.P.Sivakumar, a senior consultant pediatrician and newborn specialist from Janya Child Clinics, Chennai. And this is our YouTube channel. And in this channel, I'm gonna discuss a lot regarding child healthcare topics. Kindly do subscribe our channel. More so, it will be from the parents' point of view. See, we all know fever is just the rise in body temperature. But some parents will wonder what is the normal temperature of the body. Yes, the normal temperature of our body is when we tell in Celsius, it is 36.9 degree Celsius or 98.6 Fahrenheit. Some people do ask whether the normal temperature varies between the kids and adults. No, it is not. It is all the same. It is all the same for parents as well as the kids. And the main question is, do we really need to get concerned when there is a rise in body temperature? No, definitely not. Fever is actually a beneficial response wherein the body raises its own temperature to get rid of the germs from the body. Everybody needs a perfect homeostatic temperature to sustain, including the germs. When we raise the body temperature, it becomes very difficult for the germs to replicate themselves. So it's actually a good response. But then you might be asking, then why doctor do you prescribe medicines to reduce fever? Yeah, when there is a rise in body temperature, even our own energy expenditure becomes significantly high. See, if I say, if there is a rise in temperature of 1 degree Celsius, the heart rate increases nearly, say if it is beating at 70 beats per minute, it increases by 10 and it starts beating at 80 per minute. That is why many often when parents bring the kids, they will be saying, doctor, when we touch the heart, it's pounding, like it's kind of beating, and we could appreciate the temperature, appreciate the heartbeat during fever. So fever is actually beneficial, but becomes detrimental if the temperature rise becomes more. Another question is, which types of fever we need to get really worried about, really worked about? Yes, there are certain risk groups wherein each and every fever among such groups needs to be treated appropriately, needs to be intervened early. Any fever in the newborn and infant period, that is especially babies within the age of 6 months, it becomes very important to treat them at the earliest, because we shall not be able to pick up the early cues, the associated symptoms and signs in these children, and rapid deterioration might occur if we neglect in the initial. Any fever that is associated with chills and rigors, meaning the child does shiver with hands and legs, this indicates that there is high grade fever, and adaptive changes in the blood circulation due to fever has set in because of the fever rise. So cold and clammy extremities, we need to be worried more than a febrile hand and legs. Any child that is dull and lethargic during fever, child with poor oral intake or child unable to eat or drink, any child with continuous vomiting. So newborn period, any age up to the age of 6 months, child with a dull lethargic child, poor oral intake, child with continuous vomiting. The above symptoms shall be called red flag signs or warning signs, which needs immediate medical attention and doctor consultation. See, how do we recognize fever? It's always by monitoring the temperature using a thermometer. It is the 100% foolproof method. And touch and feel of the baby. If the thermometer is not available, touch and feel of the baby will be helpful. But sometimes during high fever, the peripheries say the hands and legs might become cold, so we'll not be able to correctly distinguish. In such a case, always concentrate on the core part of the body or the central area of the body. If it is warm, it definitely indicates fever.